Rotavirus simplified for easy reading. Rotavirus is a reovirus. It has double-stranded RNA, dsRNA. It is segmented, can reassort genes like influenza. It is the #1 cause of severe diarrhea in infants worldwide. In the U.S., it causes outbreaks in winter, especially in daycares and kindergartens. It damages the small intestine, destroys villi, causing malabsorption, leads to A absorption and K-Tice loss in stool. Mnemonic, rotavirus equals right out the anus. Watery diarrhea. Prevention, the CDC recommends routine vaccination for all infants. Contraindicated in babies with SIAD, severe combined immunodeficiency, babies with a history of intussusception, a rare but serious side effect of the vaccine. USMLE Question 1. Clinical presentation. A 10-month-old boy is brought to the emergency department in January with 2 days of vomiting, fever, and watery diarrhea. He attends a daycare and has had reduced urine output. Exam shows dry mucous membranes. Which of the following viruses is most likely responsible? A. Adenovirus. B. Norovirus. C. Rotavirus. D. Rhinovirus E. Astrovirus. Correct answer C. Explanation. Rotavirus is the leading cause of infantile gastroenteritis, especially in winter months and in daycare settings. Presents with vomiting, watery diarrhea, dehydration. Why not the others? A. Adenovirus can cause diarrhea but is not seasonal and less common. B. Norovirus, common in older children and adults, outbreaks on cruise ships. D. Rhinovirus, causes respiratory infections, not diarrhea. E. Astrovirus, can cause diarrhea but less common and milder in infants. USMLE Question 2, Structure, Pathophysiology, and Vaccine. Which of the following best explains the mechanism of diarrhea in rotavirus infection? A. Invasion of colonic mucosa and ulceration. B. Destruction of enteric nervous system. C. Villus atrophy causing anytime malabsorption and Kate loss. D. Excess serotonin release from enterochromaffin cells E. Toxin-mediated inhibition of adenylate cyclase. Correct answer C. Villus atrophy causing enamite malabsorption and K-Pice loss. Explanation. Rotavirus infects the small intestine, damaging villi. This leads to malabsorption, especially of sodium and potassium loss in stool, watery diarrhea. Why not the others? A. Colonic mucosa is not primarily affected. That's more typical of Shigella or EHEC. B. No involvement of the enteric nervous system. D. Serotonin release is associated with carcinoid syndrome, not rotavirus. E. Adenylate cyclase inhibition is seen with E. coli heat label toxin or cholera, not rotavirus. Treatment and prevention summary. Treatment. Supportive only. Rehydration. Oral or IV if severe. Electrolytes. No antiviral medications for rotavirus. Prevention. Live attenuated oral vaccine. Given routinely in infancy, starting at 2 months. Do not give if the child has had intussusception, the child has SID. Let me know if you want to cover